All right, next we're going to have Dr. Damon Cudihy, who came in all the way from Lafayette to talk with us. He is an OBGYN. He is from the practice of Acadiana OBGYN, and he's going to talk to us about non-hormonal options for care, for female care, whether it be PCOS or infertility. He's going to talk to us about that. And he's got a wonderful practice, a Catholic practice in Lafayette. But I think the lessons from his approach are wonderful to learn, Catholic or not, because it just shows us a different approach to female wellness and how to treat it. So this is Dr. Damon Cudihy.
Thank you very much. Thank you, Dr. Griffin. It's truly an honor to be here, and I think somewhat providential to have this opportunity to speak to you all. I have been blessed to take care of women in my practice throughout the state, including patients even from this area, Baton Rouge, as far north as Shreveport, and even out to Covington, New Orleans, and those other directions. So one of the things I just like to start out with, I moved to Louisiana about 11 years ago, and I found that Acadiana OBGYN. I began working with another physician who had established a practice there earlier. But one of the things that is particularly unique about my practice as an OBGYN is that it is a contraception-free practice. And this comes from what is now a unique position that used to be universal, the idea that a woman's fertility, rather than a disease, a woman's fertility is actually a healthy state. And I'll never forget in medical school when we do our clinical rotations, the first day when I was in the OBGYN rotation, the fellowship director there told us in the class that our profession had invented the best preventative medicine ever, and he was referring to contraception. And so just think about what that means, that we've invented this pill that is now being promoted as preventive medicine. So if you are the only logical basis of that is to see fertility as a disease state. And so if fertility is seen as a disease, then the child obviously is a disease. If the prevention, the contraception doesn't work, then the curative treatment would be an abortion. So ideologically, you can see that it's the concept of contraception that actually promotes more abortion and an abortion ideology rather than preventing it. So that's just an aside, but what this unique understanding and appreciation of a woman's health has done for me, and more importantly for my patients, is helped me to have a different approach to the genuine problems that women deal with. Well, I'll start by saying that that because I believe that fertility is a healthy condition, it doesn't mean that I believe every woman should have as many children as physically possible, but it does mean that there are healthier ways, holistic ways, to avoid pregnancy. And the concept, it used to be called natural family planning. For various reasons, that's gotten kind of a bad reputation. A better way to describe it now, we use the term fertility awareness. With a woman's intelligence, she's able to reliably determine the time of the month that she's fertile, and it's as simple as abstaining from intercourse during those times. And with our current understanding, it can be approximately a week, a little more, a little less of the month that the woman is capable of becoming pregnant. And by relying on this method rather than the artificial hormones and birth control pills, she's going to be protecting herself from a group 1 carcinogen, as an aside. Among the other problems of the pill, they are carcinogenic, increasing the risk of breast cancer, cervical cancer, liver cancer, even some types of brain cancer. And going back to the other big problem I think that is important to understand is that our profession in the past several decades has increasingly been influenced by the pharmaceutical industry, starting in medical school. The pharmaceutical drug reps have a really inappropriate influence in us. And I remember on this area, women's health, before I even knew I was going to be going into this field, the first time I heard the birth control pill company reps talking about contraception, hormonal contraception for its so-called non-contraceptive health benefits. And this is just the beginning of trying to push the birth control pill on every woman from puberty through menopause. And sadly, they have been incredibly successful in this century. So this, this era of modernist medicine, you've heard the expression, a pill for every ill. And I think part of what we're learning here, what I want to say is appreciation that our illnesses aren't fundamentally a result of a certain pill deficiency. It's not because we need whatever the latest drug that has been, synthesized in the lab. That's not an intrinsic deficiency. A lot of it is nutritional, behavioral, and lifestyle that is the basis of our problems. So this is most clearly applied in the women's health profession. If you were to take the top 10 gynecologic female health problems, whether it's irregular cycles, excessively heavy bleeding, painful menstrual cycles, infertility, and then associated conditions where there's polycystic ovarian syndrome, endometriosis. Every one of these conditions and many more, what we are taught in medical school and then in specialty training is that there's a pill for each one of these, and actually it's the same pill, it's a birth control pill. And if a woman, which the frequently they do, if a woman is able to tolerate the side effects, if it starts causing, nausea, weight gain, depression, these are all common side effects, anger problems, irritability, then the answer isn't to actually try something else, it's just another version of the same pill treatment. They have another pill and another one after that, maybe 10 different varieties, depending on who the physician is. What women are almost never given is an actual evaluation for the underlying causes of the problems. And so I have this, experience that is incredibly sad when I see patients that they're in their mid-30s now, and they've been on birth control pills, sometimes continuously, without interruption, since they were 13 years old. And they may have been put on it because they had painful cycles. They had nausea and missed school one day, and they went to the doctor, and then they got on the birth control pill train and never got off until they were married and haven't been able to get pregnant, and there's underlying problems that have never been addressed. And now we have the added issue of the metabolic wreckage that these artificial hormones have done to our body for many years. Another common thing is weight gain, particularly the Depo-Provera. I see young women so frequently, late teens, sometimes early 20s, that within a year being put on Depo-Provera have gained 50, 60, 80, 100 pounds. And these women have a tremendous difficulty losing that weight. It's really caused a devolving of our profession, basically, where we've been dumbed down as a specialty. We really don't know how to treat women by and large. And so those of us that are trying to take this holistic approach have to really dig deep and go beyond what we were taught in training and look for other resources and other places to learn it. And for patients too, patients are going to have to look harder to find a doctor, someone that's trained in functional medicine perhaps, or as an OB/GYN, someone that is willing to offer treatments besides birth control pills for the various medical problems. And I'll give just two examples. You've heard some things about polycystic ovarian syndrome. That's a common thing, increasingly common, and it at its heart is a metabolic issue. It's primarily needs to be addressed with proper nutrition and exercise. That was a great presentation by Jordan. I'm always going back and forth, which is more important, nutrition or exercise. Different people, one needs to emphasize more, but they're both essential, and they really do complement one another. When we're eating well and we're moving well, staying physically active and in good physical condition, that is essential. So polycystic ovarian syndrome, when a woman is not ovulating, is primarily related to insulin resistance, which is a precursor to diabetes, and often associated with obesity. There could be other hormonal deficiencies like low thyroid, vitamin deficiencies like vitamin D particularly can lead to PCOS. So what she doesn't need is what she's normally given, again, is the birth control pill. The birth control pill is going to make her insulin resistance worse. It's going to increase her cholesterol. It's going to cause weight gain. So it's going to be actually pushing her in the wrong direction. Yet, I would venture to say that 90% of women today diagnosed with polycystic ovarian syndrome, if they go to 10 different OB/GYNs, most likely every one of them are going to recommend the birth control pill. And if she asks for something else, they're going to throw their arms up and say they have nothing else to provide. And again, it's just, it's heartbreaking, and it's really a travesty and a disservice and an injustice to women. The other common thing that I see is endometriosis. Now, endometriosis is a condition where the endometrial tissue that a woman normally sheds, which has menstrual cycle, ends up implanting outside of the uterus, other parts of the pelvis. And it causes inflammation, the body's response to this tissue out of place. That inflammation in turn causes pain and infertility. So unfortunately, the treatment, primarily the central part of the treatment for most women that suffer significantly from it is surgical. Today we're able to, with surgical advances, it's normally an outpatient procedure. It doesn't take that long, and women are able to get back to their routine within a couple of weeks usually. But again, very few women are offered this type of treatment or even an evaluation to confirm the diagnosis. But one of the difficulties of endometriosis is it does require a surgical diagnosis to confirm it. And this is an important point because oftentimes women, in the course of their evaluation for pelvic pain, will have an ultrasound. And as it turns out, the majority of women with endometriosis are going to have a normal ultrasound. That doesn't mean they don't have endometriosis. Now, there are some types of endometriosis that we will see clues on ultrasound. If a woman has a large endometriosis cyst called an endometrioma, we can pick out an ultrasound, but that's not the majority of cases. And so if we're looking at an ultrasound, can give a false impression that a woman doesn't have endometriosis. So I've seen that many times. And I think these two conditions, although they're very different, they have another commonality, not only being misleading with birth control pill, but not properly recognized for the role that they have in the cause of infertility. It turns out that these are probably two of the most common causes of what falls under the category of unexplained infertility. And again, this is another of the other end of the spectrum where we've gone from seeing fertility as a disease, now fertility is something that is a right that we should be able to seek to achieve by all means necessary. Unfortunately, what women really want and what they really desire is to be made whole. They want to have the underlying cause of infertility diagnosed and corrected so that they can conceive naturally with their spouse without replacing marital intercourse with a medical procedure. Yet that is rarely done. So what ends up typically happening is a woman may be given a course of Clomid and ovulation induction agent for a couple of cycles. That may or may not work. It usually doesn't. And then very quickly, a woman will be sent to the IVF specialist. They call themselves reproductive endocrinologists, but really they're little more than IVF technicians and running an IVF factory, essentially. So every woman that is referred to the fertility specialist is given the diagnosis unexplained infertility. She normally has a slew of testing done. They test with STDs, even though she has no risk factors for it. They will do, it's called an HSG. They'll check to make sure the tubes are patent, that they're open, even though they're going to recommend IVF whether they're open or not. So a woman's charged $1,000 for this test called an HSG to find out if the tubes are open. If the tubes are blocked, which is rare, maybe 5% of the time, she's going to be told you have tubal factor infertility, you need IVF. If the tubes are open, which is the vast majority of the time, the woman's going to be told you have unexplained infertility, which is why she went there, and you need IVF. So it's another one of these exploitations financially of women, among other things, under the semblance of doing a comprehensive evaluation. So IVF is routinely recommended as the #1 treatment from day one. Now, because of how financially burdensome it is to women, most women aren't ready to take that step, so they're kind of led along with artificial insemination called IUI, artificial insemination. But ultimately, they will have to make a decision to either leave that clinic or go to IVF. And in the course of my practice of the past 11 years, I've treated scores, probably hundreds of patients that have been, what they would consider victimized by the IVF industry. They've spent their life savings, they've gone into $100,000 more in debt, trying to get pregnant with nothing but miscarriage after miscarriage. And then they come to me, and I'm trying to start over with what was never done. But I will say that there are scores of probably 100 patients at least that I've taken care of at this time that have been able to conceive after having a proper evaluation, oftentimes surgical excision of endometriosis, and they're then able to subsequently conceive. And that wasn't a part of my practice I anticipated being a big early on, but it actually has become the source of the greatest joy in my practice. People will often ask me, Dr. Cudihy, delivering babies, that must be the most exciting, part of practice. There is a real joy in that, but as Dr. Griffin can testify, sometimes babies don't come at convenient times. It could be at 3 in the morning, and it could be when we're very tired, and so we don't always have quite the appreciation that the parents do in that moment of the childbirth, as wonderful it is. But on another level, when I have a patient that's come to me after suffering from infertility, and she and her husband are there, and they're for their first visit. The baby's about 8 weeks old, or 6 weeks really since conception. The baby's about the size of a gummy bear, just about a centimeter in size. You can see the heartbeat already. You can see the arms and legs moving. We can see the baby's circulatory system distinct from the mother's. And being able to show that image, to the parents on the screen in my office, and seeing the tears of joy, and just at that moment, that is truly the greatest experience in my professional work so far. And so, and there's a particular joy there, knowing that I have helped them achieve what they ultimately desire in a way that is fully respecting their God-given dignity as a woman and their totality and the wholeness of their body. So that's kind of where I want to leave it. I will just say one thing too in treating women with infertility. The concept is one that it's probably understood as restorative reproductive medicine, and there are other physicians that take this approach beyond my specialty. There are many county practice primary care doctors. One of the prominent ones that are throughout the state are physicians who've been trained in the NAPRO technology or the Creighton model system. So there are several even in this area and in New Orleans, and I've often worked in collaboration with them. So that's one resource. I'll have some of my business cards on Dr. Crossbow's table in that back corner, along with my partner, Dr. Johnny Volts, who takes the same approach that I do in terms of treating women's health. So thank you all for your attention.
Thank you, Dr. Damon. It's a wonderful presentation and a great, unique resource to have here in Louisiana. So make sure to check that out, please.